Clubfoot is a condition present at birth in which one or both feet twist inward and point down. In southern Africa, clubfoot occurs in about 1 out of every 500 births. Researchers are still uncertain about the cause of clubfoot. It is not your fault that your child has clubfoot. Nothing that you did during the pregnancy could cause clubfoot. The Ponseti method is the recommended and most effective treatment for clubfoot. Your child will be able to walk, run, and play like any other child if you follow the treatment. Remember that clubfoot can be treated. It is important to take your child for treatment at the clubfoot clinic as early as possible in the first weeks of life. If your child is older, the treatment can still be a success, but it can take longer. It is very important for your child that you follow the treatment completely from start to end. The Ponseti method cannot succeed without the full support of the patient's family, and this means coming to the appointments and following all the instructions. The Ponseti method is in phases: the correction phase and the maintenance phase. The correction phase is usually short, about 2 months, and the maintenance phase will be until your child is 4 or 5 years old. The first part of the correction phase is the casting. When you visit the clinic for the first time, the doctor will assess your baby's foot and explain the treatment. Your baby's foot and ankle will be gently moved to correct the position and a full leg plaster cast fitted in the new position. This cast is changed every week until the foot is ready for the second part of the correction phase, which over 80% of children will need for full correction. This is called the tenotomy. If the foot is still pointing downwards, the doctor will make a very small cut above the heel, which can be done with local anesthetic. After the tenotomy is done, the heel will be in the right position and the last cast is applied. If your child is a little unsettled that night, you can give some mild paracetamol like Panado syrup. 3 weeks later, the last cast is removed and the foot is completely corrected. When you take your child home, you should always keep the plaster cast dry. Do not bath your baby. Rather use a damp cloth and be careful not to wet the cast. Check your child's toes 2 or 3 times a day to make sure they are the normal temperature and color. If the weather is cold, you can put socks over the casts to keep your child's feet warm. If the foot slips back into the cast and you cannot see the toes, it is very important to take your child to a clinic immediately. If the cast falls off, go back to the clinic as soon as you can. Check the casts for cracks and breaks. Make sure the cast isn't too tight or too loose. If your child has a high fever or the legs look swollen, the cast is too tight, or there is a bad smell from the cast, take your child to the clinic immediately. Every week, you will need to remove the cast so the clinic can put on a new cast. You should only remove the cast on the morning of your appointment. Depending on instructions, you will do it either at home or at the clinic. Put your child in a bath or basin with warm water to wet the cast. When it softens, you can unwind the bandage, starting from the little knob that the clinic leaves at the end of the bandage. A new cast is applied every week until your child is ready to wear the brace. Now that your child's feet are straight, the next part of the treatment is very important. This is what will stop your child's foot turning in again. The clubfoot brace is a pair of shoes attached to a bar in a position that keeps your child's feet turned out and the heels stretched. Even if your child only has one clubfoot, the brace must be worn. The clinic will measure your child's feet before the last cast, so they know what size shoes to use. The clinic will fit the brace to make sure the size is correct and give you basic instructions. Remember that the brace does not hurt your child. You are doing the best thing for your child to keep the brace on as instructed. Without the brace, there is a very high risk that your child's feet will turn in and you will have to start again with the correction phase with more casting needed. The brace will not stop your child from moving around as normal. It is important to keep to the brace routine. For the first 3 months, the brace must be worn for 23 hours every day. You can take it off for 1 hour a day, and this is when you can bath your child. After the first 3 months, your child wears the brace when sleeping, day or night. It is recommended that the brace should be worn for 12 to 14 hours every day. Once your child is walking, make sure that the brace is still worn for 10 to 12 hours every day when sleeping. Your child will continue to sleep in the brace until 4 or 5 years of age. The most important part of fitting the brace at home is to make sure that the foot is not moving inside the shoe. It must be securely fastened. The heel must be well down in the shoe. Most shoes will have a small hole to check this. Do not use thick socks. Thin, plain cotton socks work best. The brace will not hurt your child, so please do not remove it if your baby cries. It is important to comfort your child, but to keep the brace on. Start the brace routine from the very first day and do not change it, even if your child is unhappy. It will take most children a few days to get used to wearing the brace. Your child will quickly learn to move and lift both legs at the same time. If your child is not tolerating the brace after this, you can ask the clinic at your first follow-up appointment to check that the shoes fit well and the foot is still well corrected. You can also check that the bar isn't too narrow. The space between the shoes should be the same width as your baby's shoulders for the brace to be comfortable. As your child's feet grow, a new brace will be fitted as needed. If the shoes look too small or too tight, go back to the clinic and ask them to check the size. The clinic will give you a follow-up appointment to check the brace regularly. It is very important to go back to the clinic for a checkup. Even if you are happy that the feet are straight, it is extremely important to go to every appointment until the clinic tells you that the treatment is finished. Most clinics will have a parent advisor or a nurse that can answer your questions. You can also talk to other parents that you will see at the weekly clinic for advice and support. STEPS has information leaflets for parents to take home. Ask your clinic for a leaflet if you do not have one. You should always pay attention to your child's feet and note any changes. If your child starts to walk on the side of the foot or on tiptoe, you must go back to the clinic to check for recurrence of clubfoot. The clinic will check your child's foot and advise you. It is important to remember that you, the parent or caregiver, play a very important part in the success of your child's treatment. This cannot be done without you making sure your child is at every appointment, their casts are changed once per week, and they wear their brace every night. A successful treatment can give your child a normal life. Your child will walk, run, and play like any other child. Clubfoot can be treated.